Good morning! Just doing the much needed sun cream protest. Well, this is a vital bit of equipment. This is what we need. Rem just got the foam roller. What are we going to do today, Rem?
Probably put ourselves through a little bit of pain.
Foam rolling. Right, let's just get a proper setup and I will do a proper intro to this video. You know, professional and all that. You're walking like a man on a mission. Just a man in his foam roller.
Now let me just introduce you. Sifi. This is a foam roller.
All right.
Foam roller. This is a complete stranger.
Oh my goodness, I have just had to do all of this video again. So at least I'm well rehearsed, hey, and I know what I'm going to say. But yeah, we tried to do it in the park, but Rocco was going nuts. Here we are on take 2 of how to use your foam roller. Welcome back to my channel. Thank you so much for joining me today. Pretty sure I've just sat on an ant or something. This morning I went to the gym for my final session of the week. At the moment I'm currently going 5 times a week, and in true Sifi fashion I have not implemented any kind of mobility, rehab or recovery plan at all. But today that's going to change. A couple of weeks back I did a what's in my gym bag and I introduced you to the foam roller. It looks like this. Hang on. Ugh. I'm pretty sure that even before I pressed publish on that video I felt everyone's sigh. And I also know that I heard my husband laughing. The taunts burn. So here it is. The foam roller. Let's just recap the very basics of its purpose. This is a tool used to self-treat problem areas. The correct term is actually myofascial release, or what I refer to it in this video as self-myofascial release, or SMR, just to be quicker, easier. And SMR is a form of deep tissue massage. You can use SMR with a foam roller to aid in relieving muscle tension and any muscle tightness by increasing flexibility, increasing circulation, encouraging blood flow to areas of trauma, also breaks down scar tissue and just works through any kind of trigger points or knots in your muscle tissue. If you have already used a foam roller on a problem area, then you will know that you will feel almost immediate relief afterwards, and you'll also see a carryover to that of your flexibility. You will feel certainly more flexible after using one. So it's really effective for at least short-term effects, simply because you will feel that immediate relief, just like you would if you had a sports massage. I think a lot of regular gym goers, or especially clients in my demographic anyway, are really put off using a foam roller, just because I think somewhere along the lines we've got it in our heads that in order to elicit any kind of positive benefit from using a foam roller, that we've got to be on it for hours and hours every single day, and that is just not how it works. It's certainly not how I use a foam roller, and it's certainly not how any of my clients use a foam roller. I use foam rolling and myofascial release techniques as part of my dynamic warm-up setup before I go into the gym and hit that body part. So for example, if I'm going to go in and I'm going to do a squat session, I tend to be quite tight through my hip flexors, so I will use this as part of my dynamic warm-up. And I'll use it for 2-3 minutes along with my dynamic stretches. Static stretching has actually been shown to decrease strength, whereas myofascial release and foam rolling has actually been shown to increase your range of motion, increase your flexibility, and warm up your muscles without impairing strength. So that is why I use it, and this is why I think you should use it too. So today I want to cover the practical application of utilizing a foam roller with the view of treating common areas of complaint. So think about the areas where you feel lack of flexibility, you feel a bit of joint pain, a little bit of muscle pain, you feel like you've got limited movement. So we are going to be looking at 5 specific areas that seem to be the most common. We're going to look at working through the hamstrings, the hip flexors and other relevant muscles in the lower back. the IT band and that common area of complaint for those who enjoy running when it starts hurting their knees, and also our calves. We will take a little bit of a further look into glutes as well. This video could be incredibly long, so what Em and I are going to do is work through the body through all these particular areas, and what I'll do is I'll put timestamps in the description box so you can just fast forward to your area of complaint. Then what I want you to do is watch the technique, and then I'm going to get you to pause your video and set a timer on your phone for 3 minutes if you are doing this as part of your dynamic warm-up before your workout, or 5 minutes if you were doing this as part of an outside of workout recovery session. I've borrowed my husband. You remember him, right? Right, so first things first, Rem, how do we identify what areas we need to be working on? How do we identify what our problem areas are?
And normally the bit you can't move and it's really tight. This would be case in point.
Right, let's get into the meat of the video. I'll see you in the voiceover. Welcome to the voiceover. Don't mind me attempting to stretch out my hip flexors. We will chat about those in a minute. This part of the video hasn't gone exactly to plan, as I ended up filming it at work rather than with Rem, but it was just easier in how things went. Now, it's super tricky to be completely specific and work area by area, but all these muscles, ligaments, tendons, fascias, these are all multifaceted and they work together or in conjunction with each other. So I've done my best to be area specific, but there will be loads of crossover. Prior to foam rolling, I will always do just a little bit of cardio just to get the blood pumping, because foam rolling is a pretty intense massage. I started with the lower back. Using a foam roller for the lower back can actually cause more problems than they can fix them, and that's mostly because the lumbar has very little support and is pretty much stuck between the upper back and the pelvis. It's a very vulnerable area and it's extremely easy to foam roll horribly. So let's just take a little moment to look at what horrible foam rolling looks like and the biggest mistakes I see in the gym. So you see it there? Jamming yourself into hyperextension, compressing the lower vertebrae, rolling directly over the spine and shoving the roller right up into your ribcage. Just no, no, no. There is quite a lot going on in the lower back when it comes to muscles. So the major muscles are the erector spinae and the multifidus, which help keep us upright. You've also got the internal and external obliques and the transverse abdominals that wrap right around. And also you've got your quadris laborum, which is known as the QL, which you'll soon realise that I actually can't pronounce any of these names of the muscles, but the QL is actually the muscle that has been causing me the most trouble lately. I was really hesitant to show any sort of foam rolling for the lower back, but I do foam roll my lower back with the view of relieving tension in my QL. I find it really helpful myself, but at no point have I got my full weight on my spine, nor am I hyperextending. I've also got pretty good core strength, so I'm able to brace and hold myself up so as to avoid pressure. Personally, if you are new to foam rolling, I would steer clear of doing your lower back altogether and just use a small ball, or if you see here, I'm actually using the bell of a dumbbell to do my trigger point work, but we'll chat more about that in a moment. Because I don't want to actively encourage people to get foam rolling on their lower backs, I then work down the body and hit my glutes. Now my glutes are not particularly tight apart from my TFL, or rather my tensor fasciae latae, which is right at the top lateral side of the thigh and bum area. It works as part of the hip flexor group. So how I roll is the same for every area of the body. I start off with the general roll of the area and I try and put as much surface area on the roller as possible. So the larger the surface area, the less it will hurt, and it will get you building confidence and tolerance up to discomfort. So you can see here I'm sitting both bum cheeks on the roller and wiggling away up and down. I then take it into single sides and I start taking my rolls into smaller range, looking for problem areas. You'll know when you find what we call a trigger point, which is basically an area bunched up muscle fibers or soft tissue damage, because you will visibly jump out of your skin. You want to try and roll in the direction of the muscle fibers, which I can appreciate is hard to do if you don't know your anatomy. So the glutes, which are a pretty massive muscle group, originate from the posterior surface of the ilium the sacrum and the coccyx, and then slope at a 45-degree angle and insert into the iliotibial tract of the gluteal tuberosity of the femur. Should I just not go into the anatomy? Basically, it just starts at the pelvis, at the back, and it slopes around in a fan shape to insert to the outer part of your upper leg. Once you hit a trigger point, you'll see I actually pause on that point of pain and work over the muscle side to side. It's breaking up scar tissue and to try and flood the area with new blood to increase oxygen flow to the area. And I will keep working on that point until the trigger point starts to subside, and I'll intersperse the trigger point with longer general sweeps foam rolling, but I will work on those specific points until they alleviate. Once you've done your longer sweeps and you've worked through all your trigger points and you feel like you want a deeper massage, then you can just add a little bit of pressure to get a deeper massage. So I do this for my glutes by actually lifting my leg with the rolling glute up to rest on the opposite knee. What this does is put the glutes into a stretched position, pulling it taut, and then I continue to work through it. Here's another little side note when it comes to foam rolling. Personally, I do not do general foam rolling. I only work on the short tight muscles, so I wouldn't ordinarily work on my glutes very often because they're just not tight. They actually just don't work at all. They're not firing up. By foam rolling, you're actively encouraging, stretching and elongating the muscle, and you don't want to be encouraging that if your muscles are already long and weak. The parts I mostly am concentrating on, again, is my TFL, which is right at the top. Hit pause on this video, set your timer for 3 to 5 minutes and go ham on those tight bits. The next thing up is my poor old IT band. I am pretty sure that foam rolling your IT band can be likened to childbirth. It's intense, and you'll see many a facial expression here. It's important to know that the IT band isn't actually a muscle, but like a thick band of fascia, which is basically connective tissue that runs along the lateral aspect of the thigh, connecting several muscles to it. It's like a continuation of the tensor fasciae latae, which is that little hip flexor I've been talking about, and mine hates me. The IT band really does contribute to lateral stabilization of the knee. So think of this band of connective tissue that runs from your hip to your knee, and if you have a lot of tension or tightness in it, you may have pain in your knees or your hips, especially if you run. In fact, I find a lot of people run who will get pain in their knees because they've got a tight IT band. So you're going to work through this in exactly the same manner. However, I would not put all your body weight through this part because it will be agony. Okay, right, it's your turn. Pause this video, set your timer 3 to 5, and I'll see you in a jiffy. Next, I'll move on to my hamstrings, and same protocol, general foam rolling of the area, perhaps starting with a larger surface area. So here you can see I'm putting 2 legs together before I'll then start taking it deeper and working on 1 leg at a time, and then starting to shorten my rolls, looking for points of tension and then isolating them, working on adding pressure to the area, rocking side to side against the direction of the muscle fibre, pausing on the spot, starving it of oxygen before releasing and repeating, and then of course always flushing out the area with general foam rolling. By the end of this video, you are going to be so sick of my voice, but it's really important to do it this way. Please remember that foam rolling is an intense massage. You've got to warm up the areas before you go nuts on them. The hamstrings are massive, and although we think of them as being only the back of our leg, just like all these complex muscle groups, they have a multi-joint purpose and they are anything but linear. They are not just at the back, straight up, straight down. I am going to save you my diabolical pronunciation of the 3 major muscles, one of them being the bicep femoris. Just know that they actually come down almost from the back of the butt, right down the back of the leg, and almost wrap around the front of the knee. So you'll see that I'm not just staying on the back of the leg, I'm moving, albeit a bit awkwardly. It's very hard to do this with any kind of grace and glamour. I'm going on the inside of my leg, the middle of my leg, the outside of my leg, just working all round through the full range and then getting smaller and smaller and then starting to add pressure, rocking back and forth. You get the idea. It does look actually from this angle that I am putting quite a lot of pressure into the back of my knee. I'm not, it's just an unfortunate angle. Okay, you know the drill. Hit the pause button, set the timer, 3 to 5, go nuts, enjoy yourself, and I'll see you in a minute. Once I'm satisfied that my hamstrings are good and cooked, I will move down and do my calves. Now, the calves comprise of 2 muscles, which are the gastrocs and the soleus, and they both merge into the Achilles tendons, going from the side, the middle, and I'm just working through it with my same techniques. You know what you're doing? Hit the timer, 3 to 5, and I'll see you in a minute. You're back. My poor hip flexors are so tight and overworked, and in my experience, clients with general lower back pain have tight hip flexors. That's quite a generic thing to say. I don't mean to sound generic, it's just in my experience, and it's simply because the hip flexors, they're overworked and they're compensating for a weak core and switched off glutes, entirely encouraged by seated jobs and a very sedentary lifestyle. I've kind of just jumped right in. If we were going to really get into the nitty-gritty of the hip flexors and looked at every muscle that aid in hip flexion, I would sound pedantic and this would become more of an anatomy lesson. So let's keep this really simple. When you think of your hip flexors or hip flexion, just think of it as putting your knee up towards your body. There are so many muscles that aid in hip flexion, but there are 3 main muscles that we're really thinking of when we're thinking of hip flexors. You've got your psoas major and your iliacus, which normally people would just group together and call it the iliopsoas. So you can sort of class that as one muscle group. Again, please, my pronunciation is just generally awful. It was awful when I went through all my exams and stuff for anatomy as well. Just terrible at pronouncing them. So the iliopsoas, this is a massive muscle that originates in the lumbar spine, so that's your lower back, and it inserts around onto your femur, your main thigh bone. It sort of wraps around from your lower back to the front of your legs, or the side of your upper legs. So perhaps that's starting to make sense of why your lower back can feel a bit tight and achy. The other major hip flexor contender is the rectus femoris, which is one of the 4 muscles that make up the front of your thigh that we call the quads. The rec fem originates on the anterior inferior iliac spine, or if you just want to think the front of your pelvis, and attaches to the patellar tendon, so that's your knee, so it's all the way down or the front of the upper leg. As I'm working on my rec fem, I spend a lot of time where it feels really tight at me, which is right up at the origin. So I will concentrate on doing that first with the same techniques, and then I will go down and I'll start working on all my quads. Keep it simple, guys. Don't worry too much about anatomy. Just remember you want to go kind of in the direction of the muscle fibers. So just think in a downwards motion, and also remember the quads are a massive muscle group that run all the way down the front of the leg, and they also wrap around. So you want to go front, you want to go to the side, you want to go inside the leg. Just keep it moving. Search for those little pain points and go for it. Again, you can start off with both legs on the foam roller to provide a larger surface area if you find it too much. A lot of people have very sensitive quads, but work one leg at a time and really find those areas that are causing you trouble, and work on the areas of the muscle where you are feeling the most tenderness. So you can see here I am just pretty much not leaving that insertion point alone, I'm just going for it. You'll also see here, like I keep on mentioning, the TFL. This is a perfect position where I can show you, excuse the angle, it does look ridiculous, but that is the small part that aids in hip flexion. Mine is particularly tight, so you can really see me getting to work with working on just trying to iron out that bunched up fascia, that bunched up muscle tissue, and really try and work on those trigger points. This is actually agony for me, you can't see it, but oh, awful. Okay, you know the drill. Pause it, 3 to 5, see you back in a minute. You're back, welcome. girls, we're still on hip flexors. Oh my god, it could go on forever, couldn't it? So let's just look at some general foam rolling for the other muscles of the body that aid in hip flexion, which also get tight. You've got some more that run through kind of the front, but we're not going to look at those for this. We're going to look at the adductor muscles. So the adductor longus, brevis, gracilis, these all aid in hip flexion as well. So same protocol. Let me just leave you with showing you how I'm doing it. It doesn't look attractive. We're basically massaging my groin. It is incredibly uncomfortable. It does look ridiculous. The way I am adding pressure or getting a deeper tissue massage is I'm actually using my hand the best I can to help push down onto the foam roller. Absolute agony. Agony. This is the thing with foam rolling, and I'm sure this is why people don't do it, because if you are trying to elicit some really good results with it, you do need to be confident with it and you do need to work through pain points. It is not pleasant. So it's very counterintuitive, isn't it? We always think, well, you go to the gym to get better, you shouldn't do things that hurt you, but actually with foam rolling, if you're breezing through it, then the chances are you're just giving yourself a light little tickle massage. You're not really doing anything. Get into the nitty gritty. You're not going to hurt yourself. You're staying out of like vulnerable areas like the lower back and, you know, back of knee joints and any kind of joints. Alrighty, hip adductors, go for it. Hip pause, 3 to 5, see you in a mo. Woo! Right, that was a bit epic, wasn't it? We're done. I'm out. I hope you all found this video useful. This tiny lesson in anatomy is just there to help you with the practical application of what you're trying to fix. If you like this video, please do give me a thumbs up. It honestly helps my channel to grow, so I really appreciate it. If you are here every week but not subscribed, press that subscribe button. Inspire me to keep making content. Questions, comments, suggestions in the comment box below, and I will see you all next week. I couldn't talk to the camera doing this because there was somebody staring at me in the gym. I'll see you all next week. What have you been doing? You sweaty? Say hello. Don't touch. Don't touch. I hope everyone's enjoying the lovely sunshine, which is unexpected.
Leave it alone.
Foam roller is to use it to treat. All right. Myofascial release. Rocco, no, don't touch. Ah, so annoying. Can you take him away? And increase circulation. You're a pest. Not true. Are you joking? To elicit a benefit from using a foam roller. Busy. There's no snakes here because Mummy would be off.
There's a snake.
Run to Daddy as fast as you can. Just while Mummy does this last sentence. Off you go. Yay! Right, quickly. This is agony. This is actual agony. Oh, you smell so good. What's wrong? Okay. So, hang on a minute. Please don't wind. I can't believe it. Even the elements are against me today. This is going to be very windy. If I can hear it across my ears, you know that you guys can hear it.